So the MF-001 trial focused on anemia in myelofibrosis. And really the design of the trial centered around the idea that some patients are on JAK inhibitors and some are not, and some are transfusion dependent and some are transfusion independent. And so by that kind of 4 categories, you can come up with a 2x2 table of cohorts for this study. So those who are on JAK inhibitor, not transfusion independent, those who are not on a JAK inhibitor, not transfusion dependent, and so on and so forth. And so really we try to analyze the entire spectrum of anemia in myelofibrosis, that due to disease as well as JAK inhibition. And so we got readout from each of these 4 different categories independently. It's nice to lump all the data together to get bigger numbers, but truly these reasons for anemia are very different, and so we wanted to study each of these populations in a very different way. And so each cohort received the same active agent on top of if they were on ruxolitinib or not. So they all received Luspatercept in a similar dosing, in a similar dose escalation fashion up to a maximum dose of 1.33 milligrams per kilogram. So very similar to what the package insert states for the usage in myelodysplastic syndrome as well as thalassemia. So a couple of key findings from this ACE-MF-001 study. One is that Luspatercept can be safely combined with a JAK inhibitor, particularly Ruxolitinib. There was no excess toxicity seen from the combination. In fact, the toxicity observed from Luspatercept was pretty minimal and included headaches, elevations in blood pressure, and bone pain as the main side effects seen. No significant side effects in grade 3 or 4 side effects were seen. So 1, safe and easily combined with Ruxolitinib. 2, we saw responses in all disease categories. It didn't matter if a patient was transfusion dependent or not, or they were on ruxolitinib or not. We saw responses in all 4 groups of patients. Also, we saw responses in patients who had received prior erythropoiesis-stimulating agent, another drug commonly used to treat anemia and myelofibrosis. Lastly, we saw the largest number of responses in patients who were transfusion dependent and were also on ruxolitinib. So that served as the basis for designing the Independence trial, which is the ongoing phase 3 trial examining Luspatercept in patients with myelofibrosis.